Headaches, backaches. If you've suffered from any kind of pain, you'll want to hear what local doctors have to say.
Pain is a symptom of dysfunction.
How one man ended his agony and how you can put a stop to your own misery. Tonight at 5 on Channel 11 News. I'm Bob.
Thanks, Tricia. Later today on Channel 11 News, headaches, back and neck pains. It seems like maybe they're just a part of the aging process, but not according to local doctors. Tonight, I'll share their advice on how you can beat the pain, and sometimes the process starts at home. Watch for my report tonight at 5 on Channel 11 News.
A man found dead in his home.
My headaches are gone, so I got my quality of life back, basically.
He is proof that you don't have to live with aches in your head, back, and joints. We are talking to him and his doctors about how to live pain-free.
What would new count on?
Tonight, beating the pain. Local doctors say living with daily aches does not have to be a part of the aging process. In fact, medical experts say that there are things you can do at home to cure the common ailment. But as Channel 11's Jennifer Abney found out, the key is to identify what you're feeling.
Jason Ballant dealt with daily headaches for 2 years.
My life was unmanageable. I knew, I had to do something about it.
Pain served up with his morning cup of joe.
Nearly right after the first cup of coffee, I was getting, it just started and then it didn't finish until I went to bed.
First, he sought help from his physician. The headaches remained. Next, he hoped chiropractic help might provide him some relief.
In my world of chiropractic, headaches aren't a normal response. We shouldn't live with headaches.
Dr. Eric Grieb, a chiropractor in Wexford, treated Ballant for a misalignment of his neck. It was giving him muscle spasms and those horrible headaches. Headaches are just one type of common pain. UPMC pain specialist Dr. Zong Fu Chen says many people experience pain in their back, joints, and their spine. He recommends a combination of treatments like physical or occupational therapy.
A lot of good alternative medicines, including the acupuncture, massage therapies. If you use them early, sometimes you can avoid lots of unnecessary injections, or you can preventing the disease getting progress worse.
And Dr. Chen also recommends putting down the painkillers and picking up some weights.
And I can tell most of my patients, the painkiller, your Vicodin, Percocet, OxyContin, it's only a very small part of the treatment. Exercise not only can help you have a strong bone, help you have a strong muscular system, it's also help you sleep.
Sleep that can help ease stress or depression, which can aggravate the problem.
Great release.
Meanwhile, Dr. Grieb says it is important to be aware of the difference between acute and chronic pain as well.
Acute pain is typically in a 0 to 30-day window.
And in that time, if you can't put weight on a certain area or if you have swelling that increases, then seeking medical advice is important. Chronic pain, however, he says is much like slow weight gain.
It builds up and it builds up and it builds up in intensity. We don't even realize that we can't look over our shoulder to back our car up anymore.
Jennifer Abney, Channel 11 News.
And doctors say the first thing to do if you run into trouble at home is to go with what's called the RICE treatment. That is rest, ice, compression, and elevation. If things don't get better in 24 to 48 hours, then go see your doctor.
Meantime, a new report.
Beating the pain, local doctors say living with daily aches does not have to be part of the aging process. Medical experts say there are steps you can take at home to cure the common ailment. But as Channel 11's Jennifer Abney found out, the key is identifying what you're feeling.
Jason Ballant dealt with daily headaches for 2 years.
My life was unmanageable. I knew, I had to do something about it.
Pain served up with his morning cup of joe.
Nearly right after the first cup of coffee, I was getting, it just started and then it didn't finish until I went to bed.
First, he sought help from his physician. The headaches remained. Next, he hoped chiropractic help might provide him some relief.
In my world of chiropractic, headaches aren't a normal response. We shouldn't live with headaches.
Dr. Eric Grieb, a chiropractor in Wexford, treated Ballant for a misalignment of his neck. It was giving him muscle spasms and those horrible headaches. Headaches are just one type of common pain. UPMC pain specialist Dr. Zong Fu Chen says many people experience pain in their back, joints, and their spine. He recommends a combination of treatments like physical or occupational therapy.
A lot of good alternative medicines, including the acupuncture, massage therapies. If you use them early, sometimes you can avoid lots of unnecessary injections, or you can preventing the disease getting progress worse.
And Dr. Chen also recommends putting down the painkillers and picking up some weights.
And I can tell most of my patients, the painkiller, your Vicodin, Percocet, OxyContin, it's only a very small part of the treatment. Exercise not only can help you have a strong bone, help you have a strong muscular system, it's also help you sleep.
Sleep that can help ease stress or depression, which can aggravate the problem.
Great release.
Meanwhile, Dr. Grieb says it is important to be aware of the difference between acute and chronic pain as well.
Acute pain is typically in a 0 to 30-day window.
And in that time, if you can't put weight on a certain area, or if you have swelling that increases, then seeking medical advice is important. Chronic pain, however, he says is much like slow weight gain.
It builds up and it builds up and it builds up in intensity. We don't even realize that we can't look over our shoulder to back our car up anymore.
Jennifer Abney, Channel 11 News.
Doctors say the first step you should take if you run into trouble at home is to go with the RICE treatment. That's rest, ice, compression, and elevation. If things don't get better in 24 to 48 hours, you should see a doctor.